Thank you everybody for coming. We are excited to welcome Melissa Mackay, Dr. Melissa Mackay and Dr. Andrew Papadopoulos. Melissa Mackay is currently a postdoc in the Department of Population Medicine. She has a master's and a PhD in public health, and her research focuses on knowledge translation and mobilization in the context of public health. And she has published a guidebook for social media crisis communication for public health, and I'll put that link in the chat with permission. Excellent. Okay. And then Andrew Papadopoulos is a professor in population medicine and the coordinator of the Masters of Public Health program at the University of Guelph. His research interests include health communication to improve uptake of key messages. All right, I will turn it over to Melissa and Andrew, and I will now mute my mic. Thank you.
Thanks, Tanya. I'll just do a couple of brief and thank you for that introduction. Just to give people a little bit of context of how we got here. Melissa agreed to complete her PhD with me in February of 2020. And everybody recalls that time period because a month later we had the COVID pandemic. When Melissa first started thinking about her PhD studies, it was around social media communications, influencers, and how messages are amplified. And then when COVID hit, Melissa didn't begin her PhD until May. But then we had just a huge amount of communication that was happening through social media and misinformation, disinformation, malinformation, all sorts of these combinations. And we thought, well, it would be interesting to see what's happening in our current context. So we switched, I wouldn't quite say we switched gears, but we moved a little bit to focusing a little bit more on COVID and COVID communication through social media and looking at the topics of misdis and malinformation. So we did that, and we looked at the various different social media platforms. But Melissa is the real expert in this topic. Tanya introduced that, I have interest in health communication. That's just one area of my research, but this is where Melissa has most of the knowledge. So with that, I'll turn the presentation over to Melissa. I'll jump in a little bit partway through, but we'll kind of go back and forth, and hopefully this will be informative for everyone.
Thanks so much, Andy, and thanks for the kind introduction and for inviting us today. So a quick agenda. We just wanted to get to know who was in the virtual room today, and then set the basis for understanding those various terms that Andy just mentioned: misinformation, disinformation, and malinformation. And then we're going to go into talking about trust and some guiding principles that we developed for communicating. This was specific to COVID-19, but actually they apply, across health communication and communication in general, really to demonstrate your organizational trustworthiness and to tailor information to different communities so that, they can understand it, they trust it, and they know what to do as a result. And then we'll just sort of bring it back all together. So I'm hoping we can do some quick polls on Slido. You can either go to slido.com and type in the code 2044604 or use the QR code here. Okay, so just so we have a sense of who is in the room, if you could just answer this question about your role in animal health. Great, thanks so much. So sort of as expected, I think we have quite a few OMAFRA folks, perhaps some students and maybe analysts and others in the other category, and then quite a few veterinarians as well. Oh, and then we have academic coming in as well. Okay, so we're also curious about your views on how important you think communication is for animal health. So nobody even hesitated to say how extremely important it is. So we will sort of talk a little bit more about that throughout the presentation. And thanks for participating. We'll have a few more Slidos coming up when we talk about the guiding principles as well. So just so we're all on the same page, wanted to provide a definition of misinformation, disinformation, and malinformation. You're probably aware of this, but I thought we'd start off just being all aware of the differences. So misinformation is incorrect or misleading information, could be a myth, a conspiracy theory, just an inaccurate piece of information. It might even be half-truths, so they often stitch together truths, you know, in a very sensational way with misinformation. But the difference between mis and disinformation is that misinformation is not shared to intentionally deceive or harm. It's your, you know, mom or dad or like aunt or uncle or friend that just thinks, wow, oh, I need to share this because, you know, people need to know about this, but they're not intending to harm anybody by sharing the information. Whereas disinformation is meant to harm. So it's created by a person or an organization, and it's actively attempting to deceive. It can cause direct harm. So for example, it might impact vaccine decision-making, or it can cause indirect harm by, you know, undermining trust. And that's really the big sort of issue that I think we're all facing today. And then malinformation is based in fact and reality, but it's sort of removed from its original context in order to either mislead, harm, or manipulate. And often, you know, if you think about the change in context from a private context to public is really where malinformation sort of lies. An example of malinformation might be editing a video to remove important context or content itself, or maybe sharing internal documents that, you know, or snippets of them that were never meant to go external. So that would be examples of malinformation. So we're just curious what kind of, you know, mis, dis, and malinformation you're seeing regarding animal health in Ontario. Could be just general categories. If you're not seeing any, then, you know, feel free to not participate in this poll. So vaccination, how diseases spread, biosecurity risks. Someone said misinformation, so they're seeing that, you know, that inaccurate information is being shared without that malicious intent. The location of outbreaks, oh, that's interesting. See a few people still typing, so I'll just give it a minute. Biosecurity, vaccination, consequences of reporting testing. It's really similar. We presented at a conference, the CIFI, which is the Canadian Public Health Inspector Conference in Ontario the other day on health communication specifically, but this is very similar to what they're facing, a lot of just mis and disinformation around risk in general. Aquaculture related along the west and east coasts on disease risks, farmed wild disease transmission, non-vets diagnosing on social media, doing an autopsy for their, for their business. Okay, so quite a range, but it seems like a lot of overlap between, you know, understanding how disease is being spread and, you know, risk communication sort of in general. So sort of the key elements across mis, dis, and malinformation are that it's, you know, sensationalized often and invokes an emotional response. It often makes a really bold statement, and sometimes it's on a controversial issue. So vaccines is a great example of this. it's simplified or sometimes even oversimplified, sort of compared to how we're communicating things in animal health, public health, One Health, where we have a much more scientific basis, and often, despite our intention to be, using clear and plain language and tailoring information to our audiences, it's often not well done. And so the difference is that, mis and disinformation is very well done with the way it's simplifying information and making it very easy to understand. So it's provoking an emotional response. It's often making a bold statement, could be an extraordinary claim, like the link between vaccination and autism, for example. Often it contains clickbait, so it's driving you, like in the wellness space, for example, it's driving people to, purchase supplements, whether it's animal or human health. So they're making some sort of sensational claim about, more mainstream science. And then here, I've got the answer. You can come over here and buy a supplement from me. And really importantly, it usually stitches together pieces of real, accurate, valid information, but it's exaggerating it, distorting it, sensationalizing it. So the problem with that is that, people can verify the information. So you may be able to look up, those part truths, and then it kind of affirms like, this is real, I need to be careful. So ultimately, it's undermining trust. It's aiming to convince people not to believe official sources. So that's government, veterinary medicine folks, anybody sort of within that official space, even news media. It's planting seeds of doubt. It's making people question, the official information and even science itself. And like I said, it's stitching together those threads of truth in a way that's often more, understandable, and that invokes that emotional response. So people, feel fear, or they feel, some sort of emotional response that allows them to latch on to that information more. A lot of measures to control it lead to more distrust. So Andy and I did some interviews with folks who were vaccine hesitant, and this was during the third wave of the COVID pandemic. And they really felt like the government was censoring, those that had alternative views from government, from public health, from healthcare, et cetera. And that feeling of censorship, even if it's not true, but if it seems, like if people that are pushing this dis and misinformation are saying, that we are withholding the truth, it really is undermining what we're doing. So as well, like if we're trying to control the algorithms on social media, for example, that also makes people think, well, why do you have to do that? I want to see the breadth of information, and I want to decide for myself. I want to do my own research. So also some simplified and sensationalized messages are really key to this. And as I mentioned earlier, we don't do a great job at, providing really clear, easy to understand information that's matched to the needs of people that we are providing it for. And it's often jargony, the reading level's too high. They don't understand what they're supposed to do as a result of the information. And so this mis and disinformation is much more easy to understand, and it's invoking that emotional response. So, that's kind of the go-to. And then finally, algorithms, especially, online, well, that's where they are, but sorry, especially on social media and even like Google searches are really amplifying exposure because they really favor that simplified and sensationalized content. Okay. Andy's going to take over for a few slides now.
Thanks, Melissa. So one thing that our work discovered is it wasn't a lack of information that was causing individuals to either believe or start to really absorb the misinformation. that was being presented. And that's typically what we do. If we think back and different types of communication we've been involved with, it's usually presenting information. And we try to present the information in a neutral way so people will be able to understand that, with the presumption that if they have this information, they will act in a way that we hope to see them move in that particular direction. So we anticipate that it's, people don't have enough knowledge. And if they had more knowledge, then, our job has been done. Now, there is some truth to that, and we'll get to the guiding principles that knowledge is important, but knowledge needs to be accessible to the individual. So Melissa did mention about jargon or certain language being a little bit too complicated, maybe putting too many points in one particular message. And people were get confused from that. I know myself during COVID, I fielded numerous calls from friends, relatives, and others. People were confused. It's, I hear this, I hear that. What is it I'm supposed to do? And people would just like that information to be presented in a way that gives them some direction. We have to be very careful. And what we also discovered at times is when we're providing this knowledge or this information, it's not paternalistic. It's not do as we say and your life is going to be better. But it's in a way that what we can do is share some information so they're more informed, so that helps lead them to the decision that we hope that they're going to make. With each bit of communication, what we hope to do is build trust in what we're presenting to them. We want people to trust science, government agencies, or other officials. So when the information is coming, they aren't immediately skeptical and saying, yeah, but last time you told me to do this, we heard this numerous times. You told me not to wear a mask. Now you're telling me to wear a mask. You're telling me it's safe to do this activity, but now it's not safe. So there was a lot of that sort of thing. And the less consistent the message, the more distrust we tend to generate, obviously not purposely, but that's the way people receive it. And Melissa did mention the study we did with some vaccine hesitant individuals, and they pointed to these types of things. Now, in truth, some maybe didn't start that way, but others were looking for reasons for distrust. So the more barriers we can take down, hopefully the better it's going to be. Next slide, please, Melissa. So if we look at trust just in general, and that's what we found to be very critical, is that we want the public, when receiving our message, to be very trusting of that message, that the message is transparent, that the message is honest, that the message is providing them with good information to help them keep themselves healthy, safe, and to be able to prevent the poor health outcome that we're trying to get them. So there is some mechanisms, and some of these are hard to ascertain, shared values and decisions. Again, not being paternalistic, not telling the individuals, you must do this, you must do that. And that was one message we heard very clearly in discussing. Well, the reason we went to the vaccine hesitant people is we knew the messages we wanted to share. What we were curious about and what we wanted to learn more about is why, when we have, for example, 1,000 scientists on one side here saying this is what we need to do, and a couple of scientists on the other side saying, no, no, don't believe them, that people would choose to believe one or two people versus the 1,000 over here. What was behind that? What was making them move in that particular direction? So one of the things that we heard is that it was paternalistic. It was very directive. It was, if you don't get a vaccine, we don't want you near the rest of society. And by the way, you're killing our grandparents. That was the messages that they received, or what they heard when we were telling them. They said there was no counterpoint, there was no discourse, there was no alternative. It was, get the vaccine, or you're not allowed to go into a bar, you're not allowed to go into a hockey arena, you can't go to a movie theater, you can't do anything, you must stay at home and stay away from society, and therefore forcing them to do this. And they felt that that was very unfair and led to a lack of trust. Expertise, competence, again, trying to help people make that decision. We've probably all come across, there something in your house breaks down and you call someone up, and somebody comes by, or your car, same type of approach, and somebody says, this is what's wrong. Your first response is, okay, well, what do I do about it? And you hope that they're going to be providing you information that you can make that decision to know if it's the most appropriate decision. You don't want them to talk over you. You don't want them to just say, this is what you need to do. And if you don't do it, well, I can't help you. You hope that they engage in a dialogue and explain to you, this is what's wrong in a way that you can understand it, even though you're not an expert in dishwasher repair or fixing your vehicle, that they can explain it to you, explain why you should be doing this and the preventive actions that you need to take in repairing it. Empathy and compassion came up quite a bit as well. That two-way listening, the engagement, the understanding, the being heard, being listened to was important. And again, the individuals that we interviewed felt that they weren't being heard and they were misunderstood and that they were ostracized from society. That, if you think back to the trucker rally in Ottawa that occurred, it's, individuals went there, and that's where they got the empathy and compassion from other individuals who said, I'm like you, you're like me, let's form this community. And then that further entrenched their ideas and their distrust of others. And now they had their own community and where they were receiving empathy and compassion for their points of view. And consistency is important. And it's also important within the next bullet point here of transparency. Sometimes, especially in an emerging issue or one where we don't have full information, that possibly the message can be amended or can alter. So what we need to do is recognize that, indicate that it is inconsistent from previous messages and why the case has been inconsistent. So, the first messaging around COVID about you don't need to wear a mask, we didn't have full knowledge, but there was also the fact that we wanted the masks because they were in limited supply at that time to be used for healthcare providers or others who were in great risk. And then everybody should wear a mask to protect themselves when you're out about in public. And people saw that as inconsistency, and the transparency was never attached to that message. And then that forced distrust on people, and they didn't completely absorb that particular message. Next slide, please, Melissa. So when we looked at crafting effective messages and the work we're presenting, it was sort of touched upon here. A link will be provided to you for a social media guidebook that Melissa drafted. And it was the result of at least 4, if not 5 studies that we gathered it all together. And this book allows you to be able to help you communicate in a crisis and what type of communication. So all these components are the amalgam of different research we did. And what we found is there were 4 steps in crafting an effective message: defining an audience, drafting a message, using the appropriate channels, and monitoring and evaluating. And we'll touch on each of these. So next slide, please. The first, in defining an audience. Well, and we're kind of stuck on this one. The people around this table, I saw there were many individuals who indicated they were part of government. And as part of our communication, whether it's government, whether it's at an academic setting, whether it's doing any kind of nonprofit or public service, our audience typically is everyone or many, many people within a community. Where if we look at commercial marketers and how they define audiences, they really are able to segment populations and be able to really define some of these components. So we're kind of stuck on this one, but it doesn't mean we need to ignore who the audience happens to be. And we need to be able to communicate to that audience. Many times we put out a message, and whether it's through social media, whether it's through other more traditional mechanisms, whether it's presenting, whether it's one-on-one communication, what we need to do is understand who the audience is, how they behave, and how they like to receive that information. So you can imagine if we're communicating to a group of individuals, we need to know how they like to receive that information in terms of the wording, the language, the length. If we're doing it, for example, in an academic setting or in a setting of peers, we might have reports and documents and background supports. But if we're doing it to the general public, just hitting a couple of highlights is probably all we need to do, because what we want them to do is take that 1, 2, at the most 3 particular messages and incorporate that into their lives. So how they receive that message is absolutely critical. What are their behaviors? How can we work with their current approaches to be able to amend some of those, to be able to allow them to accept some of these new behaviors? Many things we get people to do is very different from what they would choose to do if they didn't have to do what we're asking them to do. In the public health world, we talk about people not using tobacco, minimizing substance use, exercising, eating right, all the chronic disease risk factors. These are substantive changes that people have to make. So how do we actually incorporate that and maybe incrementally move them along? What are their interests? What are they focused on? What might we be able to build upon for them to accept this particular message? Their needs, their values, their opinions of not only themselves, of their peers, of their communities. What type of messaging will we know will run right up against what their values and opinions are? Which ones can we hopefully adapt and move into that direction? The demographic information. Is it older? Is it younger? Is it rural? Is it urban? Is it uh, post-secondary educated? Is it not? There are many different components that we could look at, and hopefully what we're going to try to do is build a profile. Again, within our type of work, the demographics are very broad. They're not very targeted. And I use this example all the time, and I just did it in class last week about understanding the audience and something that students can appreciate. I talk to them about some health promotion activities that they might have been exposed to in high school. And I say, we deal with the entire high school population as one big amorphous group. But if we look at, and I ask people to reflect back on day one in grade 9, how different of a person are you than your last day when you're leaving that high school? Those 4 years or 5 years, depending on how long you decide to stay there, you are a vastly different person. So why are we communicating to that entire population in the exact same way? Targeting messages to certain groups in the way that they can accept and absorb that information is absolutely critical. So the more we can do that, the more we know about our audience, the more we know how they like to receive that information, in what channels they want to receive it, in the type of language, in the length of messaging. Those things are all critical. Next slide, please, Melissa. So in our crafting of our message, Melissa and a few other master's students that were helping her. Oh, sorry, do you mind going back one?
Yeah, there was just a recording on there for some
Oh,
reason, probably
okay,
from a past slide. Okay, it seems okay now. Sorry about that.
good. That's all right. So Melissa and two master students went through and explored all the literature and tried to find out how can we develop trustworthiness in communication with our audience. And this isn't specific to government agencies or health agencies or any group, but it's somebody who's communicating to a broad audience. How can they generate trustworthiness so our messages are received, understood, and people will want to listen to them both today and into the future? The messages, and especially with social media, we're not going to include each of these 7 components, but hopefully we'll include enough of them to make them effective. And it depends, again, on the messaging. You could have a message one week, another one the next week, another one the week after, and they could build on each of these. And so hopefully eventually you cover all these different components. So it depends on your message and its order in terms of how you're communicating with your audience. A call to action is good. And a lot of times we resort to a call to action would be this and this, go to this website for more information. And then people click on it, and it's usually a landing page, and then they have to try to find that information, and then people get discouraged and then they stop looking. Or a call to action would be a couple of very key words to say, do this. Again, you're getting your dishwasher fixed. What is it I need to do? You need to do this. So you want people to have that sort of clear instruction, call to action. Again, not paternalistic, not prescriptive, but getting people to take some action that would hopefully benefit them into the future. Clarity is very, very critical. People need to understand the message. We need to make sure that people can access that knowledge that we're trying to share with them, and it needs to be clear. People don't want to feel like you're talking down to them or that you're sharing information with them that they don't understand, and it reiterates that, oh, it's just people telling me what to do. I don't really understand this. I'm not sure this is the best thing to do. So being very clear in your messaging is critical. We talked a little bit about compassion and empathy, understanding people, understanding the challenges, understanding that there is more than just this one particular bit of information. During COVID, we had our physical lockdown policies where people were being isolated. That resulted in many other, we were able to slow down, if not stop, rates of COVID in certain communities. But what it led to was a great increase in substance misuse. It led to physical inactivity. It led to economic hardship. It led to domestic violence. It led to increased tobacco use. It led to many poor health outcomes. So understanding, and the big one, probably poor mental health. It led to a lot of these things and being able to understand that these are challenges that you're facing, but we need to do this to be able to solve this one acute issue. And hopefully what we can do is help them with some of their other issues as well. Correction of misinformation is interesting, and it can be done in different ways. We can correct misinformation by explaining to people what is the real information. We have to be very careful about not amplifying the misinformation. By responding to information, a lot of times we amplify or give credence to that particular theory. So that's a careful line to toe, but it's one that can be done fairly straightforwardly. Conversational tone. Found it interesting. We did through Melissa a study on uh, Twitter, and Justin Trudeau's private Twitter, 96% of his messages were conversational. The office of the Prime Minister of Canada, 25% were conversational. Which ones do you think people enjoyed and engaged with more? The one where you think the person is speaking with you as opposed to something that sounds a lot like a policy statement. So that conversational tone is quite critical in having people feel, oh, this message is meant for me. I should be listening to this carefully. Timeliness, again, sometimes challenged depending on your organization, but responding to things quickly, not allowing this big gap where others can come in and fill information is important. And transparency, which we've also covered, allowing people to know that they're dealing with a human, that this is an open process. I reviewed a paper for peer review, and a group did a study, and only 1% of misinformation had a fact in it. And most of them ended with questions like, it makes you wonder what else they're doing. It makes you think, doesn't it? And they had a lot of those types of questions, which just plant the seed of non-transparency. So ensuring that it is transparent and people feel like you're not hiding something from them is fairly important. So with that, I'll turn it back to Melissa.
Thanks, Andy. Okay. So I have some slides briefly gone over the methods we used. Sorry, that one slide, my apologies for that. I have a few slides that sort of go over this in detail, and then I have some examples that we pulled from our research across, I think it's mainly Instagram, but as Andy mentioned, we did do some research via Twitter as well as Facebook. But so the call to action is just directly asking someone to do something as a result of, you know, the message. So visit a website, share the post, watch a video. Here's a post quoted with call to action. Sorry. My computer's having a mind of its own right now. I apologize. I'm not sure what's going on. Clarity, as Andy said, is using plain, or I like to call it clear language, as you know, people often think we're dumbing down the science when we talk about the term plain language. But importantly, you're tailoring information to different communities so that, you know, if it's vaccine hesitancy, that is how you're tailoring that information very carefully. Here's a post. Sorry. I thought I removed all of these recordings on this. My apologies. So here is a post. I have some Slidos, but in the interest of time, I'm going to skip them, and I'm just going to sort of tell you what guiding principles are present. So this post uses call to action because there is a link at the bottom. It's hard to tell just via the screenshot, but it links you to, the Health Canada's website about what, pet owners might need to know about COVID-19. The image is well matched to the content, but there's really no sort of like clarity in terms of they're not tailoring this beyond just someone who might be a pet owner, although the text, isn't explicitly saying that. And I would say, there isn't transparency here. This was a highly uncertain time and this wasn't known. And so they didn't do a good job about saying, like, at this point, our, recommendation is if you're testing positive, avoid contact with your pets until we know more. We're not really priming the audience to understand that research cycle and that this information may change. Okay. Next, compassion and empathy. Sorry. So compassion and empathy is just showing and validating emotion. This is really important in terms of obviously risk, but also if there's hesitancy and if, mis and disinformation is present. And conversational tone, just to further elaborate on Andy's points, is just balancing friendly and professional language. So you're using the first and second person. This is really important on social media. So you're saying you, we, us, that sort of language. And this is a best practice for social media communication. It's really trying to engage in those social aspects of, social media. Next. So this post coded as clarity. I'm not sure how to turn this off. I'm so sorry. The acknowledgement of the difficulty of parent. Okay, so this post uses clarity, compassion and empathy, and conversational tone. So you can see, it's saying your mental health, it's yourself, it's acknowledging the difficulty of parenting at this point during the pandemic. So that is the compassion and empathy side of things. The image is well matched to the text. It has a parent, there's children kind of, running around. We're all sharing that tight space. You can't see it in this screenshot, but there was a link for more information. So that, I'm not sure what the link said at this point, but perhaps there was some links to support mental health. Okay, correction of misinformation. So just to elaborate on this a little bit, the best practice isn't to engage with mis and disinformation directly. So let's say your organization follows, other people or organizations that are sharing mis and disinformation. You don't want to be directly in the comments of those posts. Rather, you're creating your own information on your website, on social media that's addressing perhaps that mis and disinformation, but also really importantly, you're using sort of these guiding principles to convey, your trustworthiness and the correct information out there. So it's really important that we're doing this quickly. Across all of our research, we found that this was not done well, if at all. I can't remember the percentages, but it was quite low, the instances we saw across social media platforms. So timeliness, in terms of a crisis or an emerging issue, the first source of information is often the most trusted. So that's something to keep in mind. I know that there's a lot of roadblocks for this, especially, social media and even website communication. So, we have to do our best. And if timeliness isn't an area, we can be superstars in, then, those other guiding principles become even more important, especially clarity and transparency. So this post uses call to action. There's a link at the bottom. It is using clarity. And it's using conversational tone, and also it's correcting misinformation. So this one, kind of like Andy said, this is directly calling out a myth. In terms of this, I think it's, it's not really attached to any prevalent conspiracy theories, not really giving any, additional sort of weight to something that's circulating. It's just really kind of correcting, a piece of information that can help people make decisions to protect their health. So I think in this case, it works well. The clarity is pretty much just using clear language. It's not really tailored to anyone other than those of us that live in Canada, which is the entire general public in this case. And again, the image is, well matched to the content. It's people wearing masks, but they have, their cold weather gear on. And then finally, transparency. This is the most important strategy to maintain trust, and the one that is hardly ever used. So again, just to go over this quickly, it is really conveying sort of the balance of information. If it's an emerging topic, what we know, but also really importantly, what we don't know and how we're going to go about figuring out, that information. So if it's an outbreak, we're sharing that information that we know, and then, we're engaging in X, Y, Z steps to be able to learn more, and we will share it as soon as we understand more. So that's extremely important, and probably, well, not probably, it is the most linked to trust. This post. So this post is one of few that we found across the various platforms that use transparency. And transparency is used here by clearly showing that, or saying that research is ongoing, things may change, but based on the best available evidence right now, we think that COVID can live on surfaces for a long time. It's giving a direct request to clean surfaces, clean often, but it's really like balancing that information. This is what we know now, but it's priming, the reader at the time to understand that the evidence may change in the future. And so that when that evidence comes out, we can acknowledge that we recommended, one thing, evidence has changed, and it's not undermining trust. Okay, so the last couple steps, as Andy said, audiences are highly segmented. They have across demographics, behaviors, even like animal species that they're engaged with. So, our selection of what we're using, especially online, needs to reflect this. So, I know that, and Andy also acknowledged this, that we often just kind of communicate to the general public because of resource limitations. It's usually the main reason, and sometimes it's the skill set to be able to do a segmented approach. So, layering your approach where you're most often, providing messages geared towards the general public that are, drafted with those guiding principles in mind so that you're conveying trustworthy information. But then identifying where there's higher needs. So those, people who are maybe vaccine hesitant or don't really understand the risks in a certain outbreak. And that could be related to like education or culture or another demographic. So using sort of in terms of social media, that's highly used. That's where people are accessing health information these days. And so it needs to be used, but we need to use those social aspects on social media. So as Andy said, it's not this like paternalistic one-way flow of information where, we know best, here's the information you need to know, and just assuming that people will act upon it. We're connecting with different communities online, and we're fostering that connection between, answering comments, replying to DMs, doing like live chats or whatever it might be if there's an outbreak. Just really being there can really help with that two-way communication, but fostering trust. And then finally, we need to make sure we're monitoring and evaluating our efforts. There's a few tools that are really interesting if you use any social media management platforms like Hootsuite, for example, or Buffer is another common one. But sentiment analysis can tell you the emotional response people are having within the comments to the posts that you've made. And if you're getting a lot of negativity, that's really important to take note and to try to understand, like, why are people having a negative response? Are there questions unanswered? You know, did the information not really meet their needs, so that you can then tailor your information in the future to try to have a positive response. People are judging both the content, but also the source of the content by negativity online. So negative interactions, negative comments, that sort of thing. And then engagement metrics are another good sign. So if people are liking, sharing, retweeting, you know, commenting, they're really showing you how, not only how actively involved people are, but that it's resonating with them. And really importantly, this makes your content more likely to sort of go viral or to be shared in different networks. And that, you know, will help sort of get rid of how insidious the mis and disinformation is. So the last couple of slides before we do a Q&A are just, you know, taking action on mis and disinformation, both on and offline. Again, we need to tailor our information. So that's using those guiding principles, but especially like segmenting our audiences, understanding their values, their needs, their wants, in order to like really have our information matched to those needs. I would highly recommend, you know, creating partnerships with those that are influential. That's online, so that can be in the sense of, you know, social media, but also people on the ground. So, you know, OMAFRA has lots of people that are influential, like on farm. So do other agencies. Vets are a great source of information. So, you know, ensure those people that you know have trust with their communities have the accurate information to give out. Other trusted community leaders are certainly a good source. Health information, you know, physicians are often a good source. Faith leaders in the community are a good source. So trying to understand, you know, who in animal health are the trusted spokespersons, and those should be the people sharing the information, especially if it's an emerging issue or something where there's hesitancy, like vaccine hesitancy. And then having that sort of online community where you're using the social aspects to create that trust, support information exchange, and even mutual support where, you know, people's questions are being answered. And then, you know, importantly, you can also work directly with communities, or, you know, you have a strong network here that you can pilot test things where, you know, maybe you don't have access directly to those communities, but other people within this network do. And, you know, you can sort of pilot things that you're developing to see, do you think this will resonate, as you know this community sort of better than I do? And then finally, online specifically, like I said, you know, use your analytics, especially on social media. Understand your engagement and try to, you know, improve it if it's low. You want to look at sort of like the industry benchmarks and try to at least be there. We found official sources are very low. They're way underperforming because the information is not tailored and often, you know, not well designed. Use search engine optimization so that your website is showing up, you know, in searches. So you know, government agencies have communication people, but, you know, engage with someone who understands how to do this, so that at least if someone's searching about the topic that you're working on, you're coming up high in those Google search results. You're using social media effectively. This is a massive source of information. We need to be using it effectively. That social aspect is key here, and we're using it online and offline to engage with communities. And like I said earlier, we're not directly engaging with this mis, dis, and malinformation. Rather, we're creating these, you know, communities. We're communicating effectively using those guiding principles to sort of show our trustworthiness, maintain trust, so that, you know, we are the go-to accurate, trusted source of information. Okay. I think we'll end there because I'm cognizant that there's not too much time left. But Andy and My email is up, and then I believe Tanya already shared the crisis communication guidebook, which goes into a lot more detail on all those steps.
Thank you, Melissa, and Andrew. Does anybody have any questions? I have one. I know you mentioned not engaging in the comments of posts with misinformation, but if somebody's posting in your post, do you just ignore them or do you delete that comment? What's the best approach?
That's a really good question. Thanks for asking for that clarification. So, like, if it's a bot that you're seeing that same thing over and over and over, for sure, just delete it. If it's an honest, question, I think you can engage and provide accurate information, and, create that sort of two-way communication. I don't think you want to have this long engagement, though. I think you can provide accurate information once so that others sort of view that in your feed, but you're not going to get into like this long debate with the individual, especially if they're like sort of irate or just way far on the other side of the spectrum. You're not likely to change their mind, but you want to make sure an accurate source of information is in the chat and that you're, at least trying to engage in that way.
Thank you. I see a hand from Fernando.
Oh, yeah, just wondering how critical online engagement is or social media is when you are able to do more in-person type engagement. If you had a preference over one over the other, where would you go that way?
I could take that one. In person is always beneficial. You develop that relationship with the individual, especially one-on-one communication. It's the least efficient, but most effective. Especially if you're a trusted source and the person is able to, you're able to stand with that person and chat and discuss, and they can ask any questions. That is by far the most effective way of transmitting information. You can imagine talking to every single person individually is the least efficient way to do it, but person to person is always far superior to social media or other type of communication.
I would just add to that, I agree with Andy completely. And I think without knowing sort of like your role or what you do, I think we also need to make sure accurate, effective communication information is online too, so that for those people that are not face-to-face with you, they have that source as well. So, I'm sure MAFRA is doing that and other organizations. So I don't think it's necessary depending on, like I said, your role. If you're an on-farm advisor or something, I think that should be your focus for sure.
Does anybody else have any questions? All right, then I guess we will wrap up. Thank you so much, Melissa and Andrew. This has been a very interesting talk, and for those from several organizations, we will have this on the OMAFRA site. So if, or not OMAFRA, sorry, OAHN site. So if anybody needs to rewatch it or wants to rewatch it, or has a colleague who didn't get a chance to attend the webinar today, we will have that available. I'll send the link out. Okay, thank you, everyone.
Thank you.
Much.
Thank you.